Infectious arthritis is where you have an infection in the joint, usually bacterial. If we think of how a joint is one bone with another bone, some cartilage in the middle, and with this joint capsule that closes off the space. And usually the synovial fluid in here is sterile. This is not open to the environment, and it's sterile and clean in there. And infectious arthritis happens when the bacteria gets in there and causes an infection just like it can in the rest of the body. Now, the two bacteria that are most commonly the culprit for infectious arthritis are Neisseria gonorrhea. That's the first one. And then Staph aureus is the second one. And I've drawn this knee here because infectious arthritis usually happens, or most commonly happens in the knee, and it's just one knee. It's not systemic, so there's no reason for both sides to be affected. It's usually just in one joint. And this joint that's affected here would be red and swollen and painful. Just like having an infection anywhere in the body, this local inflammation would be there. Now, especially with Neisseria gonorrhea, you might be thinking, well, that sounds familiar. We talked about Reiter syndrome, which is one of the autoimmune arthritis illnesses. And you're right, gonorrhea is involved in Reiter's in the sense that after a local infection of gonorrhea, Reiter syndrome can develop in the joints. But just to point out really quickly, in Reiter's, first of all, the gonorrhea infection itself does not have to be local in the joint. It can be in the body in general. Reiter's. And also, we talked about in an autoimmune disease, the infection is in the blood, the orange dots being the bacteria. And then our body synthesizes these green, think of like green soldiers fighting off the infection. That's our immune system. And over time, after the original gonorrhea infection is gone, there's no more orange crystals in there, no more bacteria, but the immune system is still present. And the immune system is confused about what it's attacking, and it starts attacking this joint, which had nothing to do with gonorrhea in the first place. Now, this is a completely different process, and that's why it's called autoimmune, because our body's own immune system is causing the damage on our own tissue. But in infectious arthritis, it's different because the gonorrhea is one locally in the knee. I'll draw the orange crystals here. It's not elsewhere in the body, and it's an active infection, meaning it's not been cleared and the immune system is trying to get rid of it locally. And so infectious arthritis is not an autoimmune disease, it's simply an infection in the body. So aside from the fact that it affects usually one joint at a time, usually the knee, also if we look at the onset of time, this being the time, and this being the symptoms, it's going to start very abruptly. So as you go along, suddenly the symptoms begin. As opposed to autoimmune diseases having a waxing and waning up and down kind of course. The diagnosis of infectious arthritis should be pretty straightforward. When you're seeing a swollen red knee like this, infection should always be one of the possibilities, and you do a fluid analysis. So you take a needle, go into the joint space, draw the fluid, and you can just test it for bacteria. If it's infectious arthritis, the bacteria will grow from the fluid. But also, a person having an infection anywhere is going to have an increased white blood cell count. This is a sign that the immune system has responded. And whether you have an infection in your knee or in your finger or in your lungs or in your gut, it's going to drive this up. So it's not specific, but it tells you that an infection is going on. Now, what we want to prevent in cases of all infections, including this one, is prevent it from becoming sepsis. And that's when the infection becomes systemic. It leaks into the blood. And if you have septic arthritis, that's a step up in the severity. So if you have septic arthritis, this person will be very sick overall. They should have fevers and symptoms that are not limited to just one joint. And in this case, when you do a blood culture, you should be able to grow bacteria from that. But honestly, we want to try to keep it from becoming septic arthritis because the treatment for this is very simple, actually. Just antibiotics. We know how to deal with infections, and that's why we don't want to misdiagnosing this because the treatment is straightforward. Now, granted, infectious arthritis is not the only disease where we can have a red, swollen, painful joint, but because of the fact that it can do a lot of permanent damage and it's easy to treat, we routinely take out the fluid from the knee just to analyze it, and the fluid content will tell us a lot. And by the way, just to be complete, Staph aureus is a bacteria that we have on our skin. all of us have it. And it's usually not harmful on the surface of our skin, but if it gets into a sterile area, it can cause infection. And Neisseria gonorrhea is associated with sexually transmitted infections. And that's why in terms of the people who get this, staph aureus tends to be in older people and older children, while gonorrhea is more likely in young adults. So infectious arthritis, not autoimmune, but does involve the immune system in the way that every infection in the body does. And the treatment is antibiotics.